What is it that made all these possible in the ultimate analysis? We have already seen the most crucial elements: public healthcare, public sector, local self-governments, Kudumbasri, mass and class organizations of the people. Now, all of these are the result of public action in the state of Kerala, or all of these are part of the public action in the state of Kerala. The actions of the government can also be categorized as one element of public action. And government action to advance people's welfare in Kerala has been a result of another kind of public action, the pressure from mass movements through protests and other methods. These have taken place over a really long period of time. Right from the time when the first communist ministry was elected in 1957, Kerala has invested in public education and public healthcare, set up fair price shops to provide food grains at subsidized rates to ensure food security, implemented land reforms which broke feudal landlordism, which also increased the living standards of the peasantry and the agricultural workers, and in turn which increased the bargaining power of agriculture workers and even other workers. The working class movement has played a crucial role in Kerala's wage rates being the highest in the country, and it has been the most important factor in Kerala having the most wide-ranging set of social security measures for workers through the welfare fund boards. Democratic decentralization is something that the left has championed over a long period of time. The biggest effort in that direction was the People's Plan campaign, which was initiated by the Left Democratic Front government, which was in power during 1996 to 2001. This is how the LSGs were really strengthened, through the campaign of the People's Plan, with devolution of funds and powers to the Panchayati Raj institutions. Kudumbasri, the organization of women, organized in self-help groups with government support. There are now about 4.5 million women organized in Kudumbasri. This is also something the left has initiated in 1998 and strengthened in its subsequent 10 years. Public healthcare, that has received its biggest boost in the last 4 years during the tenure of the present left government with the Ardram mission. All primary healthcare centers are being upgraded to family healthcare centers, family health centers. Facilities in all government hospitals have improved greatly. Right now, the top 12 primary health centers in India are in Kerala, according to official rankings. This is what has really enabled the healthcare system of Kerala to stand up to the challenge posed by Covid-19. And remember, in February this year, the central government had proposed that the district hospitals in Indian states should be privatized, and Kerala said no. I would like to address one question that is often, or one point that is often raised by people, which is the argument that all these that I mentioned right now constitute a bipartisan effort. There are people like Shashi Tharoor, for example, who make these claims. Is it really a bipartisan effort? In some cases, public action from below, that is the pressure from trade unions and mass movements and so on, have ensured that the right wing in Kerala, which is led by the Congress in the state, has not been able to roll back many of the initiatives of the left completely. Nevertheless, many of these efforts were things that the right wing has tried to scuttle in the past. It has diluted land reforms legislation when it came to power. It has cut funds to local bodies when it came to power after the People's Plan campaign was set in motion. And it has tried to weaken Kudumbasri. It has tried to smash the working class movement, the trade unions. It has run down public sector enterprises. Although they have been not successful in closing down public sector enterprises because of protests by trade unions, they have managed to, whenever they came to power, they managed to run them down, run them into losses. And you see this time and again. When the left comes back into power, it turns around those public sector enterprises. Now, one public sector enterprise which has been crucial in the fight against COVID-19 has been the KSDP, Kerala State Drugs and Pharmaceuticals Limited. I had mentioned it earlier. This is one good example. This was a company which was run down by the previous Congress-led government. The present government, when the LDF came to power in 2016, turned it around, and now it is right at the forefront of the battle against coronavirus. Now, I would like to just conclude with the lines of Che Guevara from a speech he made to medical students and workers in 1960, which is as follows: the revolution's task, the task of training and nourishing the children, the task of educating the army, the task of distributing the lands of the old absentee landlords among those who sweated every day on that same land without reaping its fruit. This is the greatest work of social medicine that has been done in Cuba. I believe these words are applicable to Kerala as well, notwithstanding the fact that Kerala hasn't had a revolution and nor is Kerala socialist. That is something that we need to be careful about. Socialism is a mode of production. Kerala is not a socialist economy. It is one province in a capitalist country. Its government is led by a communist party which has the establishment of socialism as its objective. But let us not have illusions about where we are at the present. If you have illusions, you will be quickly disillusioned. I would like to conclude with that.